American retirement often departs from the advertised image of calm and oceanfront homes. For many seniors struggle with real poverty. In the United States, there is no unified state pension system comparable to the European model of social support. Most retirees rely on the Social Security program, which operates on the basis of contributions paid during working years. The average retirement benefit in the year 2024 amounted to about $1,900 per month, net, which does not guarantee comfort. Renting a small apartment in an inexpensive city usually costs from $1,200 to $1,600, consuming most of a senior's budget. Monthly bills for utilities and food average from $600 to $800, forcing choices between basic necessities. Expenses for medications and health insurance can range from $200 to $400 per month, further depleting meager resources. As a result, many retirees struggle to make ends meet and are forced to continue working even after 70 years of age. Older single people, especially women, feel the effects of low wages and employment gaps that reduce future social benefits. Seniors with chronic illnesses often forego parts of their treatment because of costs, which worsens health and increases the risk of hospitalization. Minority groups such as African Americans and Latinos experience a higher rate of poverty among the elderly, exceeding 20%. Residents of expensive states, including California, New York, and Florida, often cannot afford stable housing on low benefits. According to the National Council on Aging, about 10 million older Americans live below the official poverty line and need support. Many seniors choose to live in trailers or cars, sharing space with others to reduce living costs and survive. The growing trend known as nomad seniors means older people sell assets, buy a van or trailer, and settle temporarily at campsites. These people often take temporary jobs in warehouses, including order picking, and at petrol stations to afford fuel and food. The film Nomadland revealed the dramatic dimension of this itinerant retirement, showing hundreds of people who live on the move to lower living costs. The Medicare program provides some health care for seniors, but the coverage is limited and requires co-payments for many services. Many retirees skimp on food or heating to afford essential medications, which leads to deteriorating physical condition. The Kaiser Family Foundation estimates that the average annual cost of medications for a retiree exceeds $6,000, a serious financial burden. With an average annual retirement benefit of about $22,000, healthcare costs take a substantial share of income. In southern regions, for example in the states of Alabama, Mississippi, and Louisiana, many seniors live in old trailers without plumbing. In colder northern states, such as Michigan and Ohio, retirees sometimes keep warm despite the lack of insulation in old housing. Many people use the food stamp programs and stand in lines for free kitchens and food banks. Feeding America indicates that more than 5 million seniors lack steady access to food, resulting in chronic undernourishment and anxiety. Lack of savings and rising medication costs force older people to choose between bills and buying medicines, intensifying feelings of insecurity. Some retirees rent rooms by the hour or share apartments with strangers to lower monthly costs and avoid eviction. Long-term care and nursing home placements are often financially out of reach for many families, leaving seniors without safe care. People with limited mobility are at risk of isolation because public transport is often costly or unavailable outside cities. Senior poverty affects mental health, increasing loneliness, anxiety, and depression, which often go untreated because of costs. In regions with high property prices, seniors often decide to move far from family in search of cheaper living options. Long-term low-wage workers did not accumulate sufficient savings and today largely rely on modest public benefits. In some cases, seniors sell homes to cover medical costs, leading to loss of assets and lasting financial instability. Local communities often do not grasp the scale of the problem because seniors try to preserve dignity and hide their struggles from neighbors. Political debates about increasing support for retirees run alongside budgetary constraints, delaying implementation of measures that could improve conditions. Food security and housing stability remain central points of contention in discussions about senior policy. Faced with these realities, older people often remain invisible, even though their numbers are growing and affecting the health of entire communities. Rising property taxes and living costs push many retirees to sell homes and move to cheaper areas.